Hello, hello, everyone. Welcome to Talk the Wellness Tea with Dr. Chalice. My name is Dr. Chalice Rhodes. I am a licensed professional counselor, national certified counselor, board certified telemental health counselor, and cancer oncology behavioral health specialist. I am so happy to have you all join our panel discussion on breast cancer, mental health, and Black women health disparities. We have a phenomenal panel of women. And so I'm going to briefly share my story and briefly share a little about each panel member. And then everyone is going to share their stories. If we could all make sure that our microphones are muted, we will all share for about 15 minutes, and then we'll have a question answer period at the end. So you can ask any of us any questions. So last year, I was diagnosed with ductal carcinoma in situ, or stage 0 breast cancer. I am very grateful for my life. Thank God my mammogram caught the breast cancer and it was removed. I had a lumpectomy on September 30th of last year. And then I had to complete 22 radiation treatments. And as a way to encourage myself and to encourage others in honor of Breast Cancer Awareness Action Month last year, I actually completed a certificate in cancer oncology behavioral health. So I decided to turn my pain into purpose by creating 6-week online telehealth groups. I actually created an app. So if you go to your Apple store or your Google Play Store and download my app, DrChalice.teach or Dr. Chalice Teach, I actually have a program that I created for breast cancer survivors like myself and others on this call. So it's Dr. Chalice Teach. It's available in your Apple store or your Google Play Store. And I have a course called Thrive Breast Cancer Survivorship. I also will have my upcoming course on how to break free from emotionally abusive relationships. So please download the app. So now I'm going to just introduce the panel members. So, first I'm going to start with Dr. Tadra Anderson. Dr. Tadra Anderson is my sister in love. She is the chief medical officer at Memorial Hospital. She, thanks to Dr. Tadra Anderson, the top ladies of distinction and the top teens of America of Broward County, the Radiance chapter, is sponsoring our programming tonight. They are actually going to donate to Inspiring Life Together. And we have founder Spring Williams as one of our panel members from Inspiring Life Together. So Dr. Tadra Anderson is many things. But, just personally to me, she has been an emotional support. I remember, in times of need where I needed empathy, I remember Dr. Tadra Anderson being there for me. So that's something special in my heart that will always stay with me about Dr. Tadra Anderson. And then we have Dr. Nikita Williamson, who is a hospitalist and a pediatrician and a survivor. And I did forget to say, I don't want to share people's stories, so I'll let other people share. But a number of us on this call are survivors, and we'll all share our own personal stories. But Dr. Nikita Williamson, phenomenal. Someone who was really there for me, again, during a tough time, an emotional time when I needed to talk through divorce. And she was really there to support me. So always has a special place in my heart for that. Spring Williams, Inspiring Life Together. Spring and I actually went to high school together. And, I remember getting a South Jersey magazine and I saw my high school friend on this magazine with these pink boxing gloves looking beautiful. And I read her story of breast cancer and I reached out to her and expressed my concern. And who would have ever thought a year later, I would have been reaching out to Spring saying, Spring, I was diagnosed with breast cancer. What do I do? Help me. And Spring said, let my organization, Inspiring Life Together, help you. And I was like, yeah, but I don't even know what I need. She was like, no, we know what you need. And I remember Spring dropped off a care package to me and it had a blanket. Oh my God, a warm blanket. It had my initial on it. It had button up pajamas that I would need for radiation treatment. It had the creams that I needed. And then we have Anitra Bay, who, like me, is an Inspiring Life Together mother. And so meeting Anitra and hanging out with her, and getting to know her story, just really touched my heart. And last but not least, we have Dr. Nia Bailey, who is a radiation therapist who I recently met, and we just connected and collaborated and just helped each other out and supported each other. So I'm really thankful for the sisterhood, that is this panel. And for all of the sisters, my pink sisters, people who are not pink sisters, supporters, family members, friends, caregivers that have joined this call. So without further ado, we are going to start with Anitra Bay of Inspiring Life Together.
Thank you, Dr. Chalice, for having me. So I was diagnosed with stage 3C triple negative breast cancer. Initially, I found a lump underneath my underarms back in October 2021. I went to urgent care. The doctor at urgent care said, it looks like it's just an infected cyst. It looks like you have a cyst. She said, if it continues to come back, then just go see a dermatologist. So I ignored it. She gave me the medication, and then fast forward to early January 2022, I had pain in my right side. I felt like I had been in a car wreck, wasn't in a car wreck. So I went to the hospital just so I can get checked out. And they did blood work, and they said, we believe you're having a heart attack. So they did all these testings, gave me a CT scan while I'm in the emergency room bed. The CT scan came back on my chart. So I read the cancer diagnosis on my chart that I had a 2.5 centimeter lump in my mass in my right breast and a 2.5 centimeter lump in my armpit. And it was also by my collarbone. So that's how I started my journey. And I was already stage 3C. So it was invasive ductal carcinoma. And then I was diagnosed, and then they said it was the triple negative stage 3C. So my diagnosis was really caught late. So I started chemo in March of 2022. I also had a double mastectomy. I had 28 rounds of radiation. And I just finished my immunotherapy, which I had to do 8 rounds of immunotherapy. But thank God for me that my body responded well to the chemo process. When I did my double mastectomy, my pathology report came back. There was no cancer left in my body. So, but since early in my cancer journey, I've been sharing my story online, because once I started going online, reading the information, reading up on triple negative and the mortality rate and the mortality rate for Black women, I was like, oh, I'm telling the world. I tell anyone and everyone I come in contact with. I shared my story from beginning to end, the good and the bad, to whoever would listen. And I feel like it's so important for me to tell not just Black women, but every woman, because the early diagnosis can really save your life. Like, it is really key. Thankful for myself, like I responded well to chemo, but everybody's journey is different. But the earlier diagnosis, the better. And I truly believe that. So I started doing my own breast cancer little group meetings. I had met women online, randomly, strangers, because I talked to everybody, and I invited them out one day, like, do you want to get together? We went to Philly, got together. We started getting together every other month, just, so we can have a place where it's like it's no agenda. We just hang out and we just speak, but it's important to have a support system. I had an amazing support system. And I also got a support system from Spring through Inspiring Life Together, which I never knew I even needed. Because when you think of support, you just think of like a family support. Like you just think of somebody helping you at home with food, but you don't think of everything else that comes with outside support. So with Inspiring Life Together, she was able to help me with gift cards, groceries. She was able to help me get my grass cut. So I think it's amazing to have a great support system, which I found. But I do online support systems. I encourage people with going through the battle to just keep it moving, because cancer is not an immediate death sentence for you. Like you can still have life. Like you can go, I enjoyed my life. People will say, why are you should be inside, you should be masked up, you should be in the house. No, I was living. I made it a point to live throughout my chemo process. When I needed rest, I took rest, but I made it a point that this cancer was not going to stop my life. Stage 3C triple negative has nothing on me. Like I can go ahead and do, like it's important to not stifle yourself and not be forced to be in home. I also believed in look good, feel good. I would go to my chemo, I would be dressed. Just because you don't feel well doesn't mean you don't have to look decent because when you look decent, you feel better. Like even on my sick days, if I put on a good pair of pajamas and a good pair of sweatpants or a good pair of slippers, it still makes you feel better, although you nauseated. You could be nauseated and still look great and feel good being nauseated. So I feel like I just love to encourage women to just make them like help themselves to feel better. Like cancer is not a dead end. Like it doesn't have to stop you from going out and doing things, meeting people, going into support groups, talking to other people, encourage. Some days I was not feeling that great, but that didn't have anything with me encouraging other people in their lives via online or whether I met them in the store. So that is near and dear to my heart, making sure others are supported during their process. You know? Thank you. I know I'm cutting off early. To my heart.
No,
making sure others are supported during their process.
Yes, Anitra. And I thank you so much for sharing your story of triple negative breast cancer. Can you all hear me?
Thank you.
Okay, good. Yes, thank you so much for sharing your story. And we'll have questions. Any questions that
I know
I'm
cutting off early.
Of Anitra,
to my heart.
We'll have you
making sure others are supported during their process.
All right. Yes, Anitra. So next, we are going to have for sharing your story of Inspiring Negative Breast Cancer. Can you all hear me?
Thank you.
Pause from my side. Yes, thank you so much for sharing your story. And we'll have questions. Any questions that
I know I'm cutting off early.
Of Anitra,
to my heart.
Making
sure others are supported during their process.
Also hear that replay. So next, we are going to have for sharing your story of Inspiring Negative Breast Cancer. I'm not exactly sure what it is. Yes, thank you so much for sharing your story. And we'll have questions. Any questions that
I know I'm cutting off early.
Of Anitra,
to my heart. Making sure others are supported during their process.
Okay, ladies, can you all hear me clearly now? Awesome. Okay, thank you so much. I apologize for that feedback. We are now, so I hope you all heard me thank Anitra. Anitra, thank you so much for sharing your triple negative breast cancer story and for empowering us on letting us know that, you know, this is not a death sentence and that we can continue to live our best life now. And your strength has been very inspiring to us. So now we'll have Spring Williams.
Hi, everyone.
I
Thank you guys for taking time out tonight to come on to hear this panel discussion. And thank you to Dr. Chalice for inviting us all on. You're an incredible person. And every time I think about what you went through and how fast you got moving so that you could create this space to provide education and also just to provide a platform for us to be able to speak and bring encouragement and information to other women that they'll need through their journey, and just family members and people who are not going through the journey. It's important to bring that education. So thank you for that. So I'll talk a little bit about myself now and myself. I'll take it back to 2019 or shortly before 2019. I'm a mom. I have two boys. Currently, they're 14 and 12. And I'm married. I've been married to my husband for 16 years. And I'm also a science teacher. I teach high school biology and environmental science. And another thing that I do that I enjoy is teach fitness classes. And back prior to my diagnosis, I think I was at a place where I felt like I was living the dream, but super stressed. And when I look back at it, I think of all the things that I was doing and how I was just constantly on the go. I was teaching like 10 fitness classes a week on top of, my full-time job and being mom and being wife. And I had so much stress that I don't think I realized the amount of stress that I had. But anyway, I was looking good. I was at my peak physically. I was eating well. I was the one that would tell everybody, make sure you're drinking half of your body weight in ounces of water every single day. Stay out of bags and boxes, eat from the ground, eat your fruits, eat your vegetables. I was training for a fitness competition. I was ready to do my first bikini competition. And like I said, I was feeling good. And one day in class, I was doing bench presses and I looked over and I saw a lump. And I said, oh man, I must have pulled something. So I took a shower, I'm washing, and the lump, I would rub over that area and the lump was there. I ignored it, because I was healthy. I was drinking my water. I was eating well. I was exercising. I wasn't getting a lot of sleep. I can't say that that was the case, but so eventually I went to the hospital, and I won't say what hospitals, and you'll hear why as I continue on my story. But I went to a hospital and went to a breast surgeon, and um, he looked at the lump and he said, you need to get a mammogram. So I got a mammogram. And when they came back in to look at it, the people come in from behind the curtains and everything. I'm like, oh boy, here they are. So they look, and I guess they put whatever notes they needed to put in to send back to the breast surgeon. So the breast surgeon called me in and he said, there is this lump. I've seen this before. You have dense breast tissue. I'm sure many of us have heard that. You have dense breast tissue. No need to be alarmed. You're African American. You're young. You don't have any family history. You don't have to worry about it. I'm in the back crying because of the lump, and because when they came out to look at the mammogram, people's faces didn't seem like, they looked like something wasn't right. But the doctor reassured me that everything was fine. And then he said, but, if it will help you to get biopsy, I'll schedule you for a biopsy. So of course, well, maybe not of course, I didn't want a biopsy because he reassured me that everything was fine. And he gave me reasons to believe everything was fine. I didn't know at the time that African American women are not least likely to have breast cancer. I didn't know that age didn't play a factor. I didn't know that your level of fitness didn't play a factor. I wasn't informed about any of these things. So I went on because I didn't want a disruption in my life. And he said, if anything changes, come back. So I kept going, and I came back a year later because things changed. So when I went back in, his eyes looked like they were going to pop out of his head. So he said, you have to do a biopsy. So I got a biopsy, and a couple days later, I'll never forget, it was on a Friday. I had just gotten back to the building from a field trip with my eighth graders. I was teaching eighth grade at the time. It was on April 21st, and he called while I was at work and said I had breast cancer. And I'm like, what? And he's like, yeah, don't worry about it, because the kind that you have, yes, it is rare. It's a form of mucinous carcinoma, but it responds very well to treatment. You'll be getting some phone calls. And I'm just like, what is going on? So one of my coworkers was there, and I went and I shared with her, and she was just comforting me. And then the second place I went, I don't know why, but the second place I went was to the gym. And I told one of my fitness leader at the time there, I told him, and he comforted me, went home, told my family. And it was just phone call after phone call after phone call, morning, noon, and night. And I had the twitch in my left eye. I feel like the twitch was going on in the left eye probably for a good 2 months. And eventually someone said to me, look, what are you going to let this do? Are you going to let it break you down, or are you going to let it build you up? And I said, you're right. You're right. Because what I'm going through right now, I'm not going to move it in the right direction. So I shared with my church, and just the prayer started coming, the love, like just pouring into me. I shared with my students. One of my students in particular, her mom was going through breast cancer, and she sent me in all of these items for chemo, radiation, and surgery. So Dr. Chalice, when you talk about those items that you got, I knew what you needed because someone knew what I needed. So everything that I passed on were things that were given to me. So Anitra, I knew to ask you to get your lawn cut because somebody cut my lawn. So all of these things that, we still have to do, we have to shop, right? We have to get the backpacks for our kids. All of these different things were, I didn't know at the time, but they would be used in Inspiring Life Together. So I started my treatment in the summer because I wanted to get past my birthday and I wanted to do a 5K that I'd signed up months before. I get to this 5K and everyone's like, and they're like, this is the Stand Up to Cancer race. And I'm like, what is going on? So I had signed up for this race, and it was called Stand Up to Cancer, but at the time I wasn't diagnosed. And I was just like, Lord, and the Lord was just with me, like through it, every single step of the way. And so I did that. And then I had my first round of chemo, went through 7 rounds. Nothing was happening. I was meeting all these women, women of Black women, white women, women of all different ethnicities and backgrounds. And they're doing chemo, and they're saying that their chemo is working and they could see the tumor shrinking. And I'm like, well, mine is still the same size. In fact, it might have even gotten a little bit bigger. So by this time, I had a different breast surgeon, of course. I didn't stick with the person who misdiagnosed me. So I had an excellent breast surgeon that I went to, and I told her that it wasn't shrinking. And she said, you need to get this taken out. You need to get it taken out now. So that was a year ago today. So, like I say, God just aligns everything, even up to this very point right now, having this panel discussion with Dr. Chalice. 4 years ago today, this is, where I was getting this out of my body. So when they took it out, it was still 3.5 centimeters. And that number is significant because Proverbs 3.5 says, trust in the Lord with all your heart and lean not on your own understanding. Right? Yes. So, like I said, throughout the whole process, and I'm leaving out so many things, like so many people that I met along the way, that it was just like God was just directing me and just carrying me from one point to the next. A woman gave me a sign that I had hanging up in my room. And I would look at this sign frequently when I was having my bad days. And it said, be strong, you never know who you're inspiring. So when I got to the end of my treatment after I went through chemo, and the day before Thanksgiving, I had my oh well, today is the anniversary of my bilateral mastectomy. The day before Thanksgiving is when I had my reconstructive surgery, and I had a rough time. Like, it wasn't easy at all. I think I had every pain, but all of those things allowed me to know, all right, get the pillow, get the, the boppy pillow where you can prop your arms up on it, put that in the toolbox for people. The radiation, I had burns, really bad burns. Well, these are some good creams, get this for people and put it in a box to pass it forward. Um, so just everything. But going back to the sign, be strong, you never know who you're inspiring. So it was right at the end, and it was 2020, right before COVID hit. And I woke up one day and I was looking at the sign, and my husband was looking at the sign, and I said, it looks like be strong, you never know who you are in spring. Like, looking at the word inspiring, it looked like my name. I didn't say anything. My husband says, if you look at the word, it looks like your name's it at the same time. And I said, oh my gosh, I was just thinking the same thing. So from that, the Lord was just laying on my heart that I had to pay this forward. Like, this is what I had to do. This was my calling. This is something that He put me on this earth to do. So that's where Inspiring Life Together came from. So at this point, everything that we do is just everything that was given to me. The cards that we send out for special occasions, the milestone gifts, the backpacks, and I have pictures, and I took pictures of everything, and I posted everything. So I have, like, the woman who came over with the backpacks for my kids, and the pictures of people mowing the lawn and coming over with my meals and all of these different things. And like I said, I put it out on social media before, but I think it was also for me so that I can remember, because it's easy to forget, especially when you go through chemo. It's like somebody just hit the delete button on a lot of things in your life. So it's like a record, memoirs that I went through. So I'm just happy. I'm happy that I can be in this place um, where true healing can come. Um, Earlier, I said I was really stressed, and I think, and I'm not a doctor, of course, but one thing that I do know is when I asked women who had cancer diagnosis if they had any major stressors in their life, and not one has said to me yet that life was good and that they were at a place of peace. It seems like there was always some type of struggle or challenge or something that was disheartening going on. So when we feel that, that's our body telling us that something's not right. Like, our body will let us know when we feel that, those chemicals in our stomach and the burnings and, all of that. We have to pay attention to that and slow down and be mindful, and really, and self-care is not a selfish thing. Massages are not something that are selfish. Like, all of these things are things we need so that we can take care of ourselves and have some longevity.
Thank you so much for sharing, Spring. The importance of, because Spring is a fitness buff, and you talking about that physical piece and the self-care. I always say mental health includes our physical and our spiritual health, mind, body, and spirit. So when you talk about self-care, and we feel our emotions in our body, whether or not we want to acknowledge them or not, we feel them. When you get a headache, neck pain, back pain, your stomach is hurting, think about how you're feeling, because it's typically connected. So without further ado, thank you so much, Spring, for sharing.
Thank you.
And thank you so much for all that you do for us. With Spring being, a physical, buff, she Inspiring Life Together. And I'm so grateful for this. Inspiring Life Together, their wellness program actually got me a 3-month membership at the gym. So y'all, I am at the gym. Now listen, I've always worked out, but I'm at the gym. I did a kettlebell class on Saturday. I didn't even know I had the muscles in my arm and chest. I was like, well, what inspiring life together? Hold up now. But guess what, y'all? I'm gonna be in shape. Okay. So I am so thankful to Inspiring Life Together. And that's only one of many things, but that is available to Inspiring Life Together women. If you want to get your physical health involved, you can get a membership at the gym, and Inspiring Life Together will get you started. So now we are going to have Dr. Tadra Anderson, Chief Medical Officer of Memorial Hospital, OBGYN, mother, fabulous, just a fabulous person who really, top ladies of distinction of Broward County Radiance chapter and the top teens of America are sponsoring this program, and they are actually donating back to Inspiring Life Together. And Dr. Tadra Anderson is a part of those organizations. So it's all yours, Dr. Tadra.
Thank you, Dr. Chalice, my sister in love, who I love so much, for this opportunity to be with you all on Talk the Tea with Dr. Chalice. I listened to Dr. Chalice's previous program, and I was so inspired by her sharing. And I was like, oh my gosh, when's the next thing? I want to be a part of it, not on a panel, but just to support it. So I'm ecstatic to be here. I do want to give a shout out to my president, Broward County Radiance, top ladies of distinction, is on, Lady Keisha Hurd, and a number of our team members. So thank you to them. And as you heard Dr. Chalice say, I wear a lot of different hats like many of you ladies do. I'm going to actually be speaking today. My personal story is that I am actually a colon cancer survivor, 13 years. And I know that it's breast cancer awareness, but I was so excited that Dr. Chalice was folding in not only mental health, but all cancers that affect us and affect us disparately. So colon cancer is actually one of the top 4 cancers that we are affected by as Black people. Getting it, but it's also the number 3 in terms of Black women. And the reason I want to point that out is because we tend to think of so many other things, and colon cancer tends to be lower on our list. And yet for us as African American women and women of color, we have a 15% higher incidence of colon cancer. And we especially have that before the age of 50, just like in breast cancer. Those of us who are of color tend to have more aggressive breast cancers when we're diagnosed earlier. It's very similar in the colon cancer world. And the other thing that's unfortunate is that for those of us who have been diagnosed with colon cancer, we have a higher mortality as well. So for Black men, it's over 40% higher than their white counterparts. And for us, it's 31% higher than our white counterparts. And so my story actually started, as I said, 13 years ago. I was actually diagnosed in February of 2010. And I was only 44 years of age. So I was less than the screening at the time, which screening was supposed to be at the age of 50. And I was less than the current screening age, which is the age of 45. And I like to stress that because even though there are guidelines for screening, that's what they are. They are not the gospel truth. They're guidelines. And I love that Spring mentioned that you have to know yourself. I actually just wasn't feeling well. I'd had an accident at work. I was working as an OBGYN hospitalist at a community, actually a big healthcare system, Jackson Memorial. And I had a little accident there while trying to help a resident deliver a baby. And I just wasn't getting well. I didn't feel good. I didn't have any of the traditional colon cancer types of symptoms. I didn't have rectal bleeding. I didn't have bloody stools. I didn't have diarrhea. I didn't have severe constipation. I didn't have anything that was irregular for me. I, like Spring, was a runner. I love to exercise and run. I won't say that my diet was always well, but I sort of run and exercise to eat. So I've learned a little bit about that, and I do better now that I know better. But I really didn't do any of the things that would put me at higher risk. And I didn't have any first degree relatives, similar to some of you ladies have talked about. I didn't have any first degree relatives that had colon cancer. So at the age of 44, not just feeling well, I really turned to the Lord because I wasn't getting better. And I had a dream, and I know this is odd, but we're family of believers. And the face of my GI, a friend of mine, he wasn't even my doctor, came to mind because I went to several doctors, and similar to the first to Anitra and Spring, I was told I was fine, I was going to get better, keep taking this medicine. Well, the medicine to make me feel well, to help with the muscle relaxant. So I stopped taking it, and I just wasn't feeling myself. So I had this dream about Dr. Weiss, I'll never forget. And I called him out of the blue. And he said, Tadra, nothing's wrong with you. I had taken care of some of his family members and patients over the years. And I said to him, I said, hey, I know it sounds weird. Just see me in the office. And when I saw him in the office, I really convinced him, like, hey, I work for Jackson. They're never going to let me out of there again because I've already been off. So please. And so I remember his assistant saying, we'll schedule it. Doctor said to schedule it, but I had to pay for it out of pocket because I didn't meet any of the criteria to have it covered by my age, my symptoms, nothing. Thank God I was blessed so I could pay for it. And I had the colonoscopy done. And I remember waking up, and one of my girlfriends was there with me because my family at the time, there was a death in the family. They were in New Jersey, and I was going to go later. I remember waking up and the doctor telling us, like, thank God you did this now, because in a couple of years, it'll be really bad. And I was like, okay, I'm kind of loopy from the medication, but he cleared me to go to New Jersey to the family funeral. And after the funeral, because we were all just fatigued, I just remember waking up to my phone buzzing. And I realized my doctor had called me several times. And I, like Spring, had that immediate kind of panic feeling like, oh my God, because he's supposed to be going out of town. Why is he calling me? And I almost didn't want to call him back. And I almost got hysterical, but I did call. And Dr. Weiss said to me, he said, I don't know how to tell you this. I'm like, what? He said, you have cancer. And I was like, wait, what? Like, that whole out of body experience. And immediately, all I just remember feeling, it was numb. Like, oh my God, like, wait, what did you say? And I'm thinking, and I remember saying that out loud so many times that my family was like, is everything okay? And it's like, I remember crying, thinking like, oh my God, wait, what? And all I could do, besides being hysterical, was get on the first flight back to Florida to start looking up like what I needed to do. Because although I'm an OBGYN, I can tell you everything about breast cancer, cervical cancer, uterine cancer, any number of cancers. Colon was never in my mind. And so the good news is I was stage 1, so it was early stage, like Dr. Chalice had said. The bad news was, because I was so young and really had my genetic testing was negative, everything was negative. I was really sort of in this in-between phase in terms of what to do for treatment. And I had so much angst about it, but I remember going to my pastor, my first lady, just saying, lay hands on me, because I just need to have peace about this. And my mental state, was totally discombobulated. I just need to have peace. And I remember going to their house and then praying, and my sister came down and her praying, and any number of prayer partners. And I just finally had the peace of God that people say past all understanding, because I remembered originally thinking when they told me in February, but my surgery wasn't going to be until like April. And I was like, if I have cancer in my body, why is it going to take so long? But finally I had peace, like everything for a reason. And it was right after Easter that I had my surgery. But I remember them speaking about it at church, giving my testimony, because so many people know something is wrong with them. And I'm a physician, but you let people talk you out of it, or maybe we don't know as much as we could know. And I just want to advocate for all of us. When you know something is not right with your body, go with that. Go with God and go with that feeling. And thankfully, I had enough wherewithal to push and advocate for myself, even though I didn't know what I was advocating for at the time. Hindsight is always 20/20, but you know yourself and you know your body. And so keep pushing until you get the person who's actually listening to you. It's not in your head. I remember people telling me I'm crazy. It's in your head. You're just stressed out. And I was stressed out like Spring. I was. Don't give me a stressful time in life. But I knew something wasn't right. And that time was really, he's not going to allow anything to happen to me that is not according to his will. And I went with that. I had the surgery done because of my age. And after the surgery, the margins were negative and they gave me my options. And I did not have to have chemo or radiation. I was so grateful to God. I was vain at the time, but I knew that he would take care of whatever it needed to be. And so I did not. And so I began my journey, similar to many of you ladies, of telling the story, but also advocating for women and advocating for people who look like me. Now, I had culturally competent physician, my physician at the University of Miami-Jackson, Dr. Sands, one of the most culturally competent people I've ever known. So cultural competence is actually not about race, and it's not about color. It's about the people who understand who you are, what your goals are, and they meet you where you are to get you where you need to be so that you can be as healthy as you can be, any number of disease states, and especially when it comes to colon cancer, because most people don't recognize the huge disparity that there really is. And so I like to make sure that I'm teaching people. We unfortunately, especially as women in the colon cancer arena, similar to breast cancer, much more aggressive usually when we are diagnosed. And I'm grateful to God that I was earlier stage, and much more death. Well, we're moms and we're caretakers and we are working in our churches. We got to have stuff for us to do. So we don't want to be in a position where we can't do all that we can do. So I'm encouraging everyone, regardless of the fact that somebody might say you don't have risk factors. Certainly, if you do have risk factors, if you're overweight, your BMI is high, similar to breast cancer, you're not eating properly, if you don't have the physical activity like like Spring or some others, or you have first degree relatives who do have colon, all of those are reasons to get checked out. But even if you don't have those and something doesn't feel right, you may need to get checked out as well. The other things that I always tell people, because people do ask a lot of times about the treatment for colon cancer, and it really does vary just as much as breast cancer treatment has changed. The arena in colon cancer has changed as well. Even screening has changed. There are some things outside of just a stool culture or stool for blood. And when you go to the doctor, they check for blood. That may not be enough. So you may actually need to push for the colonoscopies, some other types of testing, and especially if you have cancer diagnosis, other cancer diagnosis in the family. So we now know that colon cancer can run in families that are affected by breast cancer or prostate cancer, or ovary. There are many different syndromes that we've now learned in the last 13 years that can be connected. And so certainly if anyone out there in listening land has people in those arenas, please make sure that you're getting checked up. And the only other thing that I would share, Dr. Chalice, in this period of time is just to make sure that everyone knows that healthcare disparities, it's multidimensional, but access to care still is an issue. The good news is for those who, let's say, maybe are underinsured or uninsured, the Affordable Care Act is still alive and well. You should still get checked to see if you qualify for one of those programs, because screening mammograms are free. And many of the other screening tests for other cancers are free. And that's one of the reasons why during the presidency of President Obama, as we now look backwards at the data, a lot of incidents of cancers actually dropped. The issue, though, is that it didn't drop as much as we'd have liked it to have seen it, because of mistrust of healthcare providers or healthcare systems, lack of access, especially in people of color, and some other things that are part of our social determinants of health. We didn't see it as dramatic in terms of prevention and mortality. So we still have a lot of work to do, but I'm definitely grateful, and I'd like to give a shout out to the Affordable Care Act persons, because as much negative publicity as it got, it definitely did help to decrease some of the incidence of cancers. And so we want to shout that out. In the colon cancer realm, just going back to that, for those of us who were under 50, like I was at diagnosis, so while the incidence declined year over year, for those less than 50, similar in breast cancer, the outcomes still are worse. And that's why we still have to have these conversations like we're having today. And we certainly want to make sure that we can close some of those gaps. So I also advocate for programs such as the NIH's All of Us, which is a research-based program. We need to get more people who look like us into clinical trials, into research, because a lot of the treatments, some of the reasons why we may not respond as well to treatments, or maybe we're not diagnosed as well, has to do with there's less known about us because we're not participating in some of the studies. So for those who can and are willing, I definitely would recommend that, so that we can get more information about what these disease states or how they might happen or occur in us from a genetic or biologic basis, but also how we then could respond to treatments to do well. So that's my CMO hat, and put that plug in for that. But I want to thank everyone. I want to thank my prayer partners. I certainly could not have done it without the phenomenal support system. And the last thing I'll say is I do remember before I went into surgery to have the left half of my colon removed, my prayer partners, including my sister and my best friend, stopping the show saying, we're going to pray. And everybody stopped in the operating room, bays like, no, we're going to pray. And so when I went in, I just felt like the peace of God really did pass all understanding. And I think that really helped my mental health. And I know you're big on that, Dr. Chalice, and we'll probably have some more to say about that. But I definitely believe that my mental health really drove where I was going to be physically and getting healed completely.
Thank you so much, Dr. Tadra. Oh my God, you said so much. Like when you talked about, so even as a colon cancer survivor, breast cancer survivor, Spring, Anitra, myself, we all shared so far. When you hear the word cancer, it doesn't matter, stage, whatever, it distress, anxiety, you can experience depression depending on the different treatments. Some people experience post-traumatic stress disorder as a result of the different treatments. So like the mental health piece is so real. And I identify with you so much, Dr. Tadra, when you were saying about the faith piece, because even, like you, Dr. Tadra, even as an OBGYN, me, even as a licensed professional counselor, I knew all of the tools to use to manage my anxiety. Nevertheless, I still experienced a high level of anxiety and distress. But you know what made the difference for me? My relationship with God, strengthening my relationship with God. And like, I remember my doctor told me, I started breaking down, crying on the phone. My mom was the first person I called. I shared with her, oh my God, I had breast cancer. She was trying to, encourage me. I remember when I talked to Dr. Tadra, and when you say prayer makes the difference, Tadra, before we hung up, she was like, let's pray. And I was on that phone bawling because there is something about that spiritual piece that it just can't, it all works together, guys. Our mental health is our mental, physical, and our spiritual health. So thank you so much for sharing, Dr. Tadra. And without further ado, we are going to move on to Dr. Nikita Williamson.
Good evening, everyone. Hi, family. How are you guys doing? I am Nikita Williamson. I am a good friend of Dr. Chalice. I'm originally from Florida, so big up to the MIA. But I live in Chicago, so I'm a pediatrician, pediatric hospitalist here in the Chi, as we affectionately call it. I have a pretty similar story to most people, but I start a little bit with a little information that I had prior to, my diagnoses. My mom was diagnosed with breast cancer at 41, and she went through the treatment, and then she got re-diagnosed at 52, I believe. So as a physician, we don't like doctors. So we don't go to the doctors that often unless we are really sick. However, we tend to go to our OBGYN, appointment. So I remember having my first OBGYN. She was an African-American woman. And, when you ask the history, they always say, have you ever gotten genetic testing? And I'm like, no. And they're like, do you want genetic testing? And I know my first OB was like, listen, if you get genetic testing, be prepared to do something about it. And I was like, what does that mean? Because what if I'm not ready to do something about it? So she was like, well, just think about it. And, I thought about it, and when this ear came out that ear. So, and again, like everybody else, I was young. I was in my 30s, and I felt like, I was healthy. I worked out. I liked to dance. So I did a lot of that. And my kids were growing up, and I was too busy doing kid stuff, and I was married at the time and being a wife. So I let that kind of pass by. And then I went on to, I changed OBGYNs, and now I'm about 38, 39. And I remember this she's a young girl. She had to be younger than me. And she was like, no, I think we're going to get genetic testing. So I can remember this like it happened yesterday. I Can you hear me now? I went in and got my testing done, and it was like the first week in December. So I quit my job because I was tired of it. I had a federally qualified health clinic job. So any of these physicians who worked in the FQAC, you know how that is. So I quit my job. I realized I needed to get a divorce. And like 2 days later, I got the call from my doctor saying, so this happened in a matter of a week, that I had the BRCA gene. So if you guys don't know what BRCA is the breast cancer gene. There's a type 1 and a type 2. And basically in the general population, females are about 1 in 8, just 1 in 8 chance of being diagnosed with breast cancer. So a 13% chance. What BRCA means that you have a hereditary genetic link to the breast cancer gene, and you are more likely to either get breast cancer. I think it goes up, and Dr. Todger, you can help me with this. I think about 70%, 72%, something like that, maybe higher. But you also have a risk of ovarian cancer, and in men, prostate cancer and pancreatic cancer. So I was BRCA 2, and so that was December 2009. So in about May 2010, I decided to go ahead and do a complete hysterectomy. I had 2 beautiful kids, which is on this call right now. My daughter's on this call. And I was like, I'm done with these ovaries, get rid of them. I don't need them. So I was fine with that part. However, the feeling that I had was, you know what, this is what makes me, I thought, at least a woman. My womb, my ovaries. And so I had some emotional feeling about it, but as we always do, we kind of sweep it under the rug. All that emotional stuff that I felt like, I'm tough, I can deal with it. But I didn't get, the counseling or the therapy that I should have gotten during that time. I just, worked through it. At the time, again, remember, I was going through job changes, lifestyle changes, medical changes. And then I thought I would be good. I'll be safe. I'll be mentally right. But if you know how your body works, your mind has to work alongside your body. So if your mind is not functioning at 100%, your body's not going to function at 100%. So after I got the hysterectomy, I thought I was fine, got back into things. Now it's time to think about what you're going to do with the other part, which is your breast. So, I went on some hormonal therapy for a minute because, once you take away your hormonal supply, they put you on low dose estrogen. But me being a physician, I'm like, wait a minute, don't this estrogen increase my risk of breast cancer? So they were like, it's low dose or whatever. But, then I had to think about what do I really want to do? So I'm sitting there thinking, people get breast, enlargements or, augmentations for fun, for birthdays, just to do, just to be, what they think is more sexy. So, you know what? That's not a big deal to lose these breasts. I get new ones, they'll pay for them. So about October the same year, again, I was 39, I got my breast removed. I got my bilateral mastectomy and reconstruction when I was 39. So in my mind, I'm thinking, all right, I'm safe. I'm good. Forget this gene. It ain't gonna get me. I got it. Fast forward 12 years later, Spring and everyone else on this call who's like very athletic. And again, I was no runner and I was not competing in no competition, Spring. I know your body is amazing, I'm sure. But I felt that I worked out pretty good. But for some reason, my stamina was like not quite the same. I thought I had congestive heart failure because I think too much in medicine. So I was like, but I still, I was like, okay, I'm gonna just go see somebody. I'm gonna do an echo on myself, no big deal. So I happened to still do my breast exams, even though I felt like, I had a reconstruction, I didn't have breasts. So just so you know, breast tissue, of course, is here, but it does expand all the way under your armpit. All right. So if you're doing your breast exams and you're going to, check for lumps, please check all of it in this area, which we call the axilla area, to make sure you don't have any lumps that you find. And Lord and behold, guess what I found? A lump underneath my armpit, my right armpit. So, you know, this is when I was in my 50s now. And I was living my best life. I thought I was. So, you know, I was going to my OBGYN and I was like, listen, I feel this lump. And she was like, you know, it just feels like a lymph node, no big deal. And she didn't get excited about it. So, which was good because she didn't get me excited about it. So she was like, let's just get an ultrasound just to be on the safe side. So the next day I got in to get an ultrasound. So being a person that had the BRCA gene before I got my breast removed, I was already prepared. Every time I went in, they found something. The fact that I was a physician, the fact that I had BRCA, and the fact that I was a Black woman with dense breasts, they're going to always find something that looks like a mass. So in my mind, I'm thinking, oh, it's just going to be a lipoma, something different that is going to be easy, benign. So I go in there, sit on the table. The tech goes out, get the radiologist, they look at it. I'm looking at it. And then she comes back in and she looks at it again. She does, you know, she looks around. And then she says, it does look malignant. And I was like, you got to be kidding me. Because I did what I was supposed to do 12 years ago to get rid of these tatas so that I can prevent. The other teaching point here is it does not take your incidence of getting breast cancer down to 0. If you do the prophylactic mastectomy, people know this more commonly, even though women have been doing this for a while, from Angelina Jolie. She got it done. It became a big old thing that, you know, you can control your incidence of breast cancer by doing what Angelina Jolie did. But a lot of people have been doing this for long, long times. So once I found out that it was, they were suspecting it was malignant, I got a biopsy. Like they all did. So the next week I got a biopsy. And it was the most common cause for BRCA, which is infiltrating ductal. They diagnosed me with stage 2 because they felt like it was in a lymph node at the time. And like, you know, Dr. Tadra said, I sat there and figured, like, I'm like, so who should I call? I have all these resources at my fingertip. Like, do I have an oncologist? Who should I call? So I looked in my phone. And I did have a friend who's an oncologist. And I remember I called her. I actually texted her and said, hey, no big deal, but I have a medical question for you. And then once I pushed send, my phone rang. So she was like, hey, what's going on? And I was like, well, this is what's going on. So she says, no worries. We got this. We're going to cure this. Trust me on this one. You're going to be 100% cured. I got this. So I was getting ready to go to Dubai for vacation. My mind is all over the place. And so she said, just go to Dubai, relax. Easier said than done. And then when you come back, we'll go ahead and take care of this. So as she said, I came back, got my port placed, went through 16 rounds of chemo. The first 12 was easy peasy, easy. The last 4 kicked my ass, kicked my whole entire ass. And in between that, we get our immunotherapy like we did. But I'm in Chicago. My family base is in Florida. No one was here. My kids are grown. They're in different locations. So my friends here and my friends there too. I mean, when I say supportive, I didn't go to one treatment by myself. They had a sign-up list. They took me every time I went to treatment. At the time, it was weekly. They made bands for me. They made T-shirts for me. But then we had to go through the whole idea of like saying, I have a gene. What do I do about my kids? So my doctor, fortunately, is not just an oncologist. She is a genetic oncologist. So she made sure we got our genetic testing, my kids, and I. She retested me, but she also retested me for all the other cancers, just to make sure that I didn't have any other genetic links. And once we did that, we found out that my daughter has the gene, but my son does not. So this starts another cycle of us doing constant screening and trying to prepare or be informed ahead of time just to make sure she's aware of the options that she has to do. as Dr. Tadra also said, that just being an advocate for yourself. I remember, she's young, she's less than 25. And, for some reason, they said that you don't do mammograms until 30. And even though she has a gene, they refused to give her a mammogram, even though her doctor ordered it. So Dr. Mom got on the phone and was like, stop playing with me. We're gonna get this done. They didn't do it though. They said no, she should start with an MRI, but she will get her mammogram in the next 6 months. So she will start her 6 months of MRIs and mammograms starting at age 25. So again, advocating for yourself, making sure you keep up with your checks, making sure if your body's changing, you tell somebody about it, and making sure you feel that mental health piece that is missing. So a part of my other thing when my friends here, they were like, yeah, you got your treatments together, but they put me on a schedule. They say you have a month to find a mental health provider. And if you don't, we will find one for you. So so I am blessed to have a great mental health provider who I see every week. And if I didn't have her, I have people I can talk to all the time. Right now I'm doing radiation. So I'm number 11 today out of 20. So I got 9 more to go, and I'll keep doing my immunotherapy until next year. And with the fact that I have BRCA, there's some new medications that I need to take for another year, but listen, we got this, we survived, and we're going to continue to survive. So I'm thankful to have this group, this panel to discuss this, to make sure everybody's informed, and very blessed for you, Dr. Chalice, to kind of open this up for all of us to talk.
Thank you so much, Dr. Nikita. And you are right in the thick of it. You're in treatment now. And here Dr. Nikita is on a panel discussion with us, sharing her story. We thank you. We thank you for taking time out of your day, and your daughter. We're praying for you guys. I know that must be so scary. I can't even imagine with there being a gene, because I remember the distress I felt when they were like, so, get the genetic testing, and they counsel you like, okay, so you have to be prepared because this can reveal some things that you may, just like you said, Dr. Nikita. And so I can't imagine you already knew that it ran in your family, and then having the genetic testing and finding out, oh, wow, I have it too. And now we're going to the next generation and finding out that Lauren has it, but Miles didn't. So, we're just praying, even for Lauren and her treatment and her peace of mind, because breast cancer, like younger women are getting breast cancer that, don't even have the gene. And so many organizations have come along to try to build that support around young survivors, because the rates are just increasing amongst our younger women. So I thank you so much, Dr. Nikita, for sharing your story. And listen, Dr. Nikita said, she was on her way to Dubai. I don't know. She said she still went to Dubai and lived her best life. Sent me pictures. She was in the desert with these beautiful dresses and just shining like the diamond that she is. So thank you so much, Dr. Nikita, for sharing your story and encouraging us. You're going through the journey now. I think we are all out of our journeys that are on the panel, but that's not to say that we're done though, right, ladies? Because we still have to get mammograms. Like I had my first, so I finished 22 radiation treatments December 21st of last year. In July, I had to get my first mammogram. And this time I was like, I'm walking in here, faith over fear, and I had the mammogram, I had the ultrasound, and I'm so blessed and just praise God that I'm cancer free. Everything came out well. But, this is the thing with breast cancer survivorship. It doesn't stop just because we had the lumpectomy. We finished the radiation. We finished the chemotherapy. This is actually a lifelong process, because you have to see the radiation, a doctor. I'm going to alternate, they said. They're going to keep a close eye on it, because, what I didn't share as a part of my story was in 2017, they actually said that I had a cyst on my right breast, and they didn't act like it was a big deal. I didn't think it was a big deal. Like Dr. Nikita, I continued to live my best life. Nobody said it was a big deal. And, they said that I had dense breasts. So Spring, they told you, Nikita, myself, Anitra, I can't remember if they said that you have dense breasts, but so dense breasts actually hide cancers. They don't show up on mammograms, right? So when they said that I had a cyst on my right breast, I didn't think that it was anything. I continued to live my best life now. Now we fast forward 5 years later, and it does turn out to be breast cancer. So I feel very grateful for my life, especially with it being at stage 0, when the breast cancer surgeon, Dr. Fantabulous Fantasio was her name. I call her Dr. Fantabulous. We got another Dr. Fantasio, patient. But listen, she is fantabulous. And she said when she went in to remove the cancer, she said, Chalice, it almost escaped out of the milk duct, because ductal carcinoma in situ is cancer that is found in your milk duct. So when I tell you guys, I am so grateful to God that over those 5 years where they thought that was just a cyst, that actually was cancer, that it stayed inside of my milk duct and it did not spread to the rest of my body. I am so very grateful. And because it stayed in the milk duct, I did not have to have chemotherapy, but I did have to have the 22 radiation treatments. And, that's a process in and of itself. So no matter what our diagnosis is, no matter where we are in the process, it's still scary, and it's very normal. And getting the mental health help, it really does help. And some of us, like myself, were getting mental health therapy before we even found out that we had cancer, because like myself and like many others, we were working on other cancers, if you know what I mean, that were showing up in our life, right? And it happens a lot in the form of relationships. When we talk about stress, most of our stress comes from relationships. So when we look at it, and I see people in the chat, I see Tina, stated in the chat how she was stressed out in the military before her diagnosis. In 2017, when they found that, that cyst, in my breast, I know I was going through 3 different stressors all at the same time. So a family stressor, work stressor, being new to a department in academia and facing, the cultural toxicity there. And then, filing for divorce and going through a divorce. So when we think about these stressors that happen in our life, cancer comes in other forms other than colon cancer and breast cancer. Sometimes relationships are cancerous, and we need to get rid of some things because it's actually fueling, and then it might show up in our body as a cancer. So let's see. I see we have 4 new messages, but last but not least, we are going to get to Dr. Nia Bailey. Dr. Nia Bailey is a radiation therapist. She is going to share with us. And so welcome, Dr. Nia.
Hey, Dr. Chalice. Thank you so much for this wonderful opportunity. Ladies, I have so many questions. Ms. Spring, I need to know what doctor that we can curse out together in the name of Jesus, because we need to talk to the doctor. That was the West Philly side of me. Anitra, Dr. Nikita, Dr. Tadra, we have some conversations to talk about offline, because this is just too much. I feel like as Black women, we always get the business, but that's a different story. So I'm a radiation, can you hear me? I think it's, okay. I'm a radiation therapist. I've been a radiation therapist for almost 10 years. I got into this field because my dad, who's on the call, was diagnosed with prostate cancer. So I had to get in the same field that helped my father, and he's doing well. He might kill me for this, but I think he's 13, 14, 15, 16 year survivor. So I'm very blessed about that. God is good. So when I've been in clinic, I was noticing so many young women being diagnosed with breast cancer and getting the radiation. And I said, what is going on? I feel like I did not learn that women between the ages of 18, 24, 36, 42 could get breast cancer. I felt like when I was learning, it was either pediatric or geriatric and nothing in between. And one woman in particular, we looked just alike. At the time, I had box braids like her. We had a gold anklet together. We liked I'm from Philly, a Philadelphia rapper. We loved the same rapper. And she passed away at the age of 24 years old, and she had 2 children. And I said, what is going on? And the similar stories like that. I had a woman named Kwania Lopez, funny woman. And when she found out that her disease was terminal, she divorced her husband. She was in the hospital with oxygen tubes. She had multiple metastases in her lungs. And she asked me how the research was going. And I had no answer to give her. No answer at all. But it wasn't until my patient turned good friend, Jacqueline Smith, passed away at the age of 34. I said, something has to be done. I don't think that we know our risks. So I created a documentary entitled A Letter to My Sisters, a breast cancer documentary for young women, which highlights 3 phenomenal women and their breast cancer journey. So the one woman, her name is Janique Rivera. She's Jamaican, Chinese, and Puerto Rican, and she was diagnosed when she was 29 years old. And she tells her story of advocacy. She had this pain in her right breast forever, and nobody will listen to her. So finally, and Janique don't play. I think she's from Compton or something. She don't play. She said, if you don't image my breast, I will take it out in front of you and you're gonna have to do something. So they did. And it turned out she had stage 3 triple negative breast cancer. She knows her body. She advocated for herself. She received chemo. And like Miss Spring said, she said, I think my lump is getting bigger. They said, no, it's not. Keep doing it. She said, I'm not going to keep doing it. So they imaged her. It turned out it was getting bigger. She knew her body and kept advocating for herself. The breast cancer metastasized to her lung. She had a 12-centimeter mass to her lung. She kept advocating for herself. Metastasized to her brain, 6 centimeters in her brain. Kept advocating for herself. And let me tell you something. She is married with 3 children. Like we said, like everybody said, it does not have to be a death sentence, but the point of advocacy and knowing your body. And if somebody's not listening to you, go to somebody else to listen to you, because it is your life and you keep pressing forward. The second woman, her name is Brenda Durante. She's a Mexican American woman. In her interviews in Spanish with the English subtitles, I had my best friend come all the way from California, Philadelphia to interview her. And she said, Mexican women don't get breast cancer. I didn't know. She said, we're too busy taking care of our children, cooking, cleaning. She said, I didn't have time, but it showed her to finally have time for herself, because you can't pour from an empty cup. So she tells her story. And she was diagnosed in her 30s. And the last woman, she is Swedish, Irish, and German. And she was diagnosed when she was 41 years old. And she basically said, as a single mom, I didn't have time, but now I do. And I have more time because I need to be there for my children. So she tells her story. And what we really wanted to get from this documentary is, from watching it, learn your family cancer history, talk about genetic testing, like everybody said, clinical trials, advocating for yourself and knowing your body. And this has empowered me so much so to bring this into my life. So I know my father, as I said, he had prostate cancer. His father had colon cancer. On my mom's side, there's prostate, multiple myeloma, breast, lung, et cetera, et cetera. I took this to my physician. She put it in a risk assessment. I have a greater than 20% chance of getting breast cancer. So let's take it back. At 21 years old, I had colonoscopy. 5 years ago, I had a colonoscopy. Starting at 28 years old, I got a breast MRI and a 3D mammogram. I did genetic testing. And I did something called West sequencing, which is the whole genomic testing. So I don't have to keep getting retested. And it turned out that while I don't have BRCA1 or BRCA2, I do have a gene called BCL6, which increases my risk of lymphoma. I did not get scared at all. Why? Because that information is so powerful. Because now I get screened, I get blood tests. If I ever do get lymphoma or breast cancer or colon cancer, I know that it's going to be at a low risk, and that increases my chance of a beautiful prognosis that I can live my life. And I can then give this information to my mom and my brother and my family, which I have done. And so, my mom has done that too. And she comes from a time where she's like, don't ask me about clinical trials, don't ask about nothing. But she has finally done that, because I think it's because of my nieces, and she wants to be able to have some information and some power. And we talked about disparities too, and that really gets me. Ms. Spring talked about stress, and I really think that has so much to do with the diagnosis, especially in our community. I feel like, at least where I come from, Inner East, South Carolina, where my family comes from, it was always, as a woman, you take care of your husband, you take care of all your children, you cook, you clean, and from A, and then you're at Z. So you take care of yourself at the end. And by the time that it's at the end, you had all these aches and ailments that you just ignored because you were so busy taking care of everybody else. Not just that, I come from, like I said, Inner East, South Carolina. My cousins still eat pig feet. I'm not knocking pig feet, but I'm just saying it's not healthy. There's nothing on their plate that's colorful, nothing. It looks all black and brown. And listen, I love me some cheesesteaks. I'm from Philly, but I understand that it's about balance and that my plate needs to look colorful. I understand that I need to at least walk 30 minutes a day. It doesn't have to be weightlifting because I would pass out, Miss Spring. I can't do all that, but I'm going to at least walk a little bit, right? I understand that when I decide to have children, that I should try to breastfeed. I understand that drinking alcohol and binge drinking increases my risk of getting breast cancer. I understand that smoking anything, weed, hookah, cigarettes, increases my risk. I understand that for myself, I need to achieve a healthy body weight. We all have different body weights, but you know what that healthy body weight looks for you. I understand that. And this is the resources and tools, not only from the documentary, but just being a radiation therapist, that I try to teach not only to the patients, but so they can bring those tools to their families as well. Because yes, some things may be inevitable, environmental, but my mom always says there's some things that don't have to be genetic, certainly like eating, right? I don't eat pig feet. I'm not going to do that, but they still do. Maybe you eat chitlins, maybe you eat cheesesteaks every Fridays like I used to. But the point is, there's ways that we have in our power to reduce our risk. And it's so important. And like Dr. Tadra said, with clinical trials, we talk about Tuskegee experiment, we talk about Henrietta Lacks and all the medical apartheid that has happened in our culture. And it is so true. But if we always let fear overtake us, then we're not going to receive the medicine that helps within our DNA. And it's so important to know that. You think about how HIV/AIDS in the 80s was a death sentence. And now if you get diagnosed, you can live with it, right? Same thing. This is how we want breast cancer and colon cancer and prostate and all cancers to be. If it's not going to be eradicated, at the very least that it's at a chronic disease, so that if you get diagnosed with it, that sting of death gets taken out of it. You don't want it, but you at least know that you can still live. And that's the whole point of providing resources and tools and having this phenomenal panel that Dr. Chalice has set up to provide you with that information that you can not only take for yourself, but for others as well.
Wow. Thank you so much, Dr. Nia, for sharing in your story and your family history and the importance of the genetic testing and all of the different cancers that run through your family. That's so awesome that that history, because I think that we need to empower ourselves and we need to ask about what our family history is, right? Because I didn't find out until after I was diagnosed with breast cancer that I do actually have a family history of breast cancer. So I, said, well, how can I, we can't control anybody else. We can only control ourselves. So what we can do to empower ourselves is we can ask the elders, what is the history? Is there a family history? But then for the elders, pass the information down to the family. We need to know what our history is, because had I known in 2017, when they said there's a cyst on your right breast, and if I would have known at the time, oh, wait a minute, hold up. My grandmother on my dad's side of the family, 2 of her sisters had breast cancer and double mastectomies. Oh no, hold up. My grandfather's sister, she had breast cancer. If I would have known that when they said to me, you had a cyst on I would not have gone on living my best life. I would have advocated for myself to say, oh, I have a family history, right? But I didn't find out until after. But it's okay. We can, just educate the generation, pass the information down to my sons, have them pass information, down. So thank you so much for sharing. I am so grateful for all of you phenomenal panelists, that have shared your stories. We're going to use this last, about 10 or 15 minutes, if you guys can hang in there, just to see if anyone has any questions or any comments to ask of the panel. So let's see. Thank you, Dr. Bailey. Please share how one can get cancer screening. So Dr. Bailey, this question is for you. It's in the chat. If you guys have any questions, put it in the chat and I'll read it.
Absolutely. So if you have a provider, they could, I feel like can you hear me?
Yes, you're good.
Sorry. If you have a provider, they can write you a script, but they may ask, like I said, the family cancer history, if you have family cancer history, and they'll put that in assessment, and they will either set you up with an ultrasound, set you up with the mammogram, either a screening or diagnostic. And because my family cancer history was over 20%, that's why I was able to get the 3D mammography, and then also the breast MRI. If you don't have insurance, I believe you can still go to the hospital and ask for a social worker, and they can provide you with information of where to get a screening. I know the American Cancer Society, excuse me, if I can talk, you can contact them. There's other organizations that you can get a screening to find out your risk.
Thank you, Dr. Bailey. Okay, and Yvonne Young says, I lost a best friend a year ago. I'm so sorry, Yvonne, to hear that. My question is, why are women still losing the battle to cancer? Ooh, well, let's see who any of our doctors, our medical doctors want to answer that. Our battle to breast cancer. Why are women, because when this panel is Black women health disparities. So health disparities, what are your thoughts, Dr. Tadra?
Yes, that's a great question. And I too empathize with you, Ms. Yvonne. I think there's a couple reasons. Number one, we heard from someone earlier that even for their daughter who has a gene, that they didn't want to give her the proper screening. So I think one of the reasons is access, lack of access, depending on where you live.
Breaking up just a
So
little
you
bit.
can have be underrepresented. People really need to be screening, and that's where self-advocacy, you're finding Dr. Bailey, but also the Susan Komen Foundation, especially during this month, particularly with breast cancer awareness. You can actually call, they have vans that will, mobile vans that will go out and do screenings in underserved areas. So make sure that you're checking that. And then the other big thing is, in terms of, we tend to get diagnosed later. So we've all heard, tonight, some of us maybe were reassured falsely. That's why we have to also know something for ourselves. So some of us got false reassurance that everything would be okay because of our age. And as you've already heard, age, while there's a tendency for breast cancer, colon cancer to be in older people, we see it in younger people of color. And that's a big distinction. If you are a person of color, actually, one of the other big groups right now that's having a higher risk of breast cancer is Caribbean Americans. So people from the islands like Bahamas, there are some recent studies, they are at higher risk for having some of the same BRCA genes that we used to think only happened in Jewish populations. So there's some genetic backgrounds, but also just getting to the diagnosis later. When you get to the diagnosis later, or if you're younger, particularly, and have triple negative breast cancer, and I'm so excited that many of the young ladies here are doing well, it's harder to treat triple negative breast cancer. And so those cancers tend to be more aggressive, that affect us as women of color at earlier ages. And so we definitely have to go and get our screenings, know what your screening should be. The other thing I would say is that if you have a family history, colon, breast, you need to be doing your screening at least 10 years before that diagnosis. And that's in the absence of any kind of genetic issue. So for instance, I was diagnosed at 44. My kids should get screened starting at 34 because I was 44. They 10 years before me, unless they actually had a genetic issue. My genes, of course, were negative, as I shared earlier. But for those of you whose genetics were positive, you have to do that genetic risk like Dr. Bailey's talked about, and follow up with your doctor based on what your risk assessment is. So going to your regular appointments is just as important. Doing your own, some doctors say, oh, you don't need to check your breast. I don't believe in that. And the major societies still say we should be doing our own breast self-exams. So those are some of the things that we can actually do to help ourselves in terms of an earlier diagnosis, increase our chances of survivability.
Thank you so much, Dr. Tadra. And then we have.
So Dr. Chalice,
yes.
I just wanted to put my doctor on the spot since she logged in. So Dr. Shayna Roselle is my oncologist and my genetic oncologist. So she actually logged in, and I told her I'm going to put you on the spot.
Oh,
so
wow.
Maybe you can weigh in on this question.
Hi, Dr.
Hi, everyone. She called me. I said, oh man, I need to get on here. So thank you for inviting me to your panel. Lots of great discussion. So as Dr. Williamson had mentioned, I am an oncologist, and I see a lot of African-American women, particularly here in Chicago and the Chicagoland area. I'm pretty much kind of the only African-American doctor kind of on the south side of Chicago. So it's not many of us, but I think also my niche is that I run a high-risk genetics clinic. And so I am, discussing, high risk genes, and it's not just BRCA. People really think that, hey, you have this BRCA gene. It's not just that. You have PALB2 genes, you have CHEK2 genes, you have Lefermini. There are so many different genes that can predispose you to breast cancer that many people are not aware of. And so not only counseling patients, but also family members to get tested and talk about various ways, to provide prevention or screening. I think in terms of our communities, it's a number of issues. One is, again, not talking to each other. We don't really talk to our family members. It's a huge barrier. I mean, even in my genetics clinic, I see that many patients don't even want to bring their children. Number two, people are afraid. People are afraid as to, what could this diagnosis mean? What are the implications, not only just, for the family, what are the implications as far as insurance? Many insurances are not covering, life insurance policies, for instance, if they actually know you have a gene mutation. So it's a lot of different things. And then it's another issue with lack of access to care, lack of education, food deserts. And so all of these things that were mentioned tonight are kind of things that, we need to try to kind of improve this disparity. So there's a lot of work that needs to be done.
Can I ask a question?
Sure.
Okay, so I actually have a comment. So when you mention insurance, that's a big deal that I think that we need to be aware of in our community as well. When I got diagnosed, someone came up to me who sold insurance. He took my fitness classes and he asked me if I started treatment yet. And I said I didn't. And he asked me if I had life insurance and I said I didn't. And he said, well, you need to get the life insurance now before you start your treatment because your rates are going to be significantly higher. So he said that once you get those tests done, if things show up and the insurance companies find out, they'll give you a higher rate. And I had no idea about that. So, as we get our family members checked, we need to be, mindful of that. And then my question for you was about the Oncotype test. Can you tell me, so with the Oncotype test, is that test to tell you what the likelihood of the chemo working would be? Or what does that test do?
So Oncotype or MammaPrint, those are two different type of genomic assays that tell you what's your recurrence within 5 years or 10 years. This is only given in patients who are hormone positive. So if you are, for instance, triple negative, you're not a candidate. And it essentially says that, yes, I'm going to be taking my endocrine therapy, whether I'm taking tamoxifen or anastrozole. And it gives you a number and it tells you, what is my risk of this cancer coming back? If the risk is high, then you're having a evaluation discussion with your doctor on whether or not you need to do chemotherapy in conjunction with your hormone blocker to lower that risk. And if that risk is low, then you can say, arguably, it's safe to not actually use chemotherapy. Is it 100%? No. With Oncotype, there are kind of some areas, gray areas. We also talk about age. If whether or not, if you're a younger patient, would you necessarily apply these things? If you had a lymph node that was positive, kind of variation. But for the most part, that is what the Oncotype or MammaPrint does.
So at what point, okay, so I'll just tell you that I had a lymph node positive, hormone positive, chemo didn't work. I keep asking, and I asked when I was initially diagnosed, and now that I'm on tamoxifen, I keep asking about the Oncotype, and they keep telling me that I'm not a candidate.
So how many lymph nodes were positive?
One.
So it was one lymph node that was positive. And how old were you when you were diagnosed?
I was 41 when I was diagnosed.
Okay, I don't see why the Oncotype didn't apply. I mean, technically, it's studied in patients who have 1 to 3 lymph nodes that were positive, but given your age, they might have just said, "Hey, we should do chemotherapy," just because you were younger.
But the chemo didn't work. I had 7 rounds.
7 rounds, and you still had a recurrence?
It didn't work. It was either the same size or may have grown. So they stopped and didn't give me the 8th one, and I had the surgery.
Did they switch you to something else?
I'm now on tamoxifen, Zoladex, and they're now wanting to get my ovaries removed. And now they're talking about a hysterectomy.
Okay. And so it's a number of things. So it's possibly that the chemotherapy didn't work. And that's just by the nature of the disease. You're probably more hormone sensitive. And so I would agree. I mean, given your age, there are studies. One of them is called the Text and Soft trial, which they looked at patients who were pretty much younger, and they had the most benefit from ovarian suppressor. So you're on Zoladex, tamoxifen, and then there's a question of whether or not to actually remove your ovaries or not, if you're not going to have any children or more children.
Yeah. Okay.
It's a little complicated. Sorry.
Yeah, it's a lot. Thank you.
Anybody else have any questions for Dr. Shana?
Sorry.
No, this is good because we're happy that you're here to join the panel, Dr. Shana. We got another level of expertise, but that's how Dr. Nikita does it. She always come in with a 1-2 punch.
I mean, a 1-2 punch.
Oh,
What?
Anybody?
So
I had a comment,
Oh,
Dallas.
Okay.
I just wanted to thank you to Dr. Roselle for coming on and sharing that. As she was breaking that down, for a lot of people, your head spins. And so you have to have someone like her, a specialist, someone who knows that detail to talk to you. And for you, Spring, if you don't get the answers you want, that's why it's important to seek out people like her who is a subject matter expert, obviously, but clearly is also culturally competent, has taken her time out to come be with us survivors and talk to us on a program that she really didn't have to do. And I think that if nothing else, cancer is complicated, but we must find the right people to help us get through what we get through, whether it's for like Dr. Roselle in the oncology space or the mental health, like Dr. Chalice. You can't say it enough because it is complicated and we're all individual and we want individualized treatment, but we have to find the right people who can help us through the journey that we're on. And we start with God first, ask him to put people in, but thank God that, Dr. Roselle came in the right moment for such a time as this to break it on down. And that's how God really does it. So I appreciate that.
Okay, and Anitra.
So my question is about the Ki-67. Is it true that the higher your Ki-67, the better your body reacts to chemo? Because I had a very high Ki, mine was 97%.
Okay. So Ki-67 is it's a rate that we use as far as tumor proliferation, which means how fast is this cancer growing? Anything that's greater than 20% is considered more aggressive. Okay. So something that's 97% is extremely aggressive. With that being said, we say it's a little bit more responsive to chemotherapy by the nature that the chemotherapy is trying to kill any fast growing cell. So I wouldn't say it's necessarily more responsive or aggressive. I just think it's just by nature of it being a more aggressive tumor that you are seeing a response. With that being said, it depends on the institution you are at. So for instance, Harvard, many of them are not looking at Ki-67 as a measure of the kind of aggressiveness of the tumor because it's not necessarily reliable with every patient. So it kind of varies. I still look at Ki-67 as a marker because it does tell me, hey, this is a fast growing cancer. I need to act pretty quickly.
Thank you.
Okay, and I want to read Felicia. So Felicia says, if I don't feel right, what does that sound like when I go to the doctor? I've done it and I've had tests, but I sometimes feel like I'm not being heard and I don't persist, thinking I'm overreacting. What do I say?
Who's that for?
Who would like to answer that? And does that stand out to anyone? any of our medical doctors, because listen, it is difficult. I feel you, Felicia. As a patient, you know, that doctor-patient relationship. Well, we are experts over our bodies. We've been with our bodies longer than the physicians have. But then the physicians have this expertise. And then a lot of times I hear women, you know, it's like how I didn't question, you know, the doctors when they said, oh, you have a right cyst on your breast. They didn't make it seem like it was a big deal. So neither did I. In talking to a lot of breast cancer survivors, they do feel that imbalance in power, or when they do question their providers, you know, some have reported to me that their providers start mistreating them because now their providers feel like they're questioning their expertise. So they don't feel like they're getting anywhere because maybe the doctor is blowing them off and saying, oh, no, you'll be fine. Just trust what I'm saying. But then you have these fears and you have these worries and you want to be able to ask your provider. So I do want to know from like a medical standpoint, do you all have any advice to Felicia or other survivors who are facing this?
So Felicia is another one of my good friends from Florida. I'm her forever pediatrician because I think these disparities, like Dr. Tadra said, I think she has such fears of going to her own doctor to talk. She calls her friend, who's a pediatrician who takes care of kids, to ask these questions. And that's unfortunate, but you know, as always, Felicia, how we talk about this is you have your voice and you have to stand up for yourself. As you hear in many of these discussions right now, that if we didn't stand up for ourselves or just say, hey, can you check this out, or ask for more testing or ask for more things to be done, a lot of us wouldn't be here right now. You know, this is something that we all going to have to do better in the healthcare field at promoting more. You know, it's hard because, again, our culture, we don't like doctors. We're afraid of doctors. We think they're going to give us cancer. People think if they cut you open, it's going to spread the cancer. It's just a lot of different myths that are out there, but you have to speak up for yourself. You have to advocate for yourself. And, you know, and if not, you have friends like me who will advocate for you. So, you know, definitely keep speaking up and keep asking and keep taking care of yourself. And I think that's the advice I have for you. And to speak on Felicia, she is her mother passed away of breast cancer, and today is her mother's birthday. So she's on this talk with us today. And she has been one of my big advocates also, but she is actually on this talk today. And this is her therapy today on her mother's birthday to be here with us.
And Felicia, we are sending prayers to you and our heart goes out to you. It can be so difficult around the anniversary of loved one's death. You may find that you're re-experiencing symptoms that you may have experienced when they first passed away. So we thank you for being here. You know, Dr. Tadra asked me to share some mental health resources. And so, you know, it's really, Dr. Tadra, you want to share something before I start?
Please. I took out my notebook. One of the things I advocate for patients is to write down whatever questions or what you're feeling and share your top 3 with your doctor. You know, unfortunately, in the world of medicine, physicians are going. But when you go prepared, write it down, which I advocate to do, your top 3. I feel like you've done these tests. I don't know what they mean. I don't know what it is that you were looking for, what you've ruled out, what else, because in my mind, I feel like I'm not well or I don't feel well. I have a family history of breast cancer, and that's how you put it to them. Write it down, those questions, how you're feeling, and then make them sit there and have them, you know, ask the questions and have them answer. And again, if you're not getting the right answer and Dr. Nikita's not a phone call away that moment, find some else who is to listen to you. But I would definitely say we don't take our questions, especially post-COVID, and I cannot remember certain things, but if I go with it written down, then they have to address it like my own checklist, because they have a checklist, I have a checklist, and that's what it would sound like to me.
Yes, thank you so much, Dr. Tadra. And so Dr. Tadra wanted me to share some of the mental health resources. So listen, My surgeon, my breast cancer surgeon, when she met me, we were hitting it off. We were laughing and joking, and she was making me feel better because I had lots of questions. Dr. Tadra, I had that whole list. I had did my research. I wanted to know why I needed to have radiation treatment because I had read a few research studies where some women with DCIS did not have to have radiation treatment. And Dr. Fantasio broke it down. She said, okay, I hear you, but you have grade 3 DCIS, meaning your DCIS is aggressive. So you have to have radiation treatment. But then she looks at me, she says, wait a minute, what do you do for a living? And I said, oh, I'm a therapist. She said, we need you. She said, I don't have anybody to refer my women to. Even after I was diagnosed, and when I went to look for a therapist that specialized in cancer, breast, I don't care if it was any kind of cancer, I couldn't find one. Dr. Fantasio was right. There's not like there's all of these breast cancer therapists. So after Dr. Fantasio asked me that, 2 weeks later, I got an email from one of the insurance companies that I'm contracted with saying, we're calling for mental health providers to become cancer oncology behavioral health specialists. I took that, I answered the call because like many of you ladies, when we are trying to make meaning, and we don't always like to talk about it in spiritual communities, Christian communities, but we question God and we say, God, why did this happen to me? Why did I get cancer? And to make meaning out of this, when my surgeon told me they didn't have therapists, she said, I want to refer people to you. And when 2 weeks later, I got that call to become a cancer oncology behavioral health specialist, I was like, oh, this is how God wants me to turn my pain into purpose. So I actually became what I could not find. It's kind of like how Spring, the resources that Spring received from her support system, she then turned that into Inspiring Life Together. Like I said earlier, in honor of Breast Cancer Awareness Month, I completed that certificate program in cancer oncology behavioral health. And I said, I'm going to help myself and I'm going to help other women. And so I developed this breast cancer survivorship course. I have 6-week online teletherapy groups for people that live in Georgia, Florida, Delaware, New Jersey, the hospital system that you receive care. I attended the support groups with the hospital system. Now, breast cancer support groups are available. They're very much needed, but they are different than therapy groups, right? So, breast cancer, support groups, it could be something like this, where you're in a group with other survivors and you all are talking and you're supporting each other. My therapy group's different, that I'm using evidence-based trauma-informed practices that I was trained in, when I went to school. And it's time limited. So there's also, another question when I was on a panel last week asked, well, how do we find a culturally competent therapist? For the majority of African-American women, I would say all of the African-American women that I've spoken to, they want a Black therapist. They just do. People just do. Some people it doesn't matter to some people, but if available, Black women want a Black therapist. And so a great place is therapyforblackgirls.com. They have a therapy directory and you can search for your therapist. You can see the picture of the therapist, right? You can search by location. You can search by specialty. There's also Taraji P. Henson. Her father had a mental illness and she established a foundation called the Boris L. Henson Foundation. You can also go onto her directory. You can search for therapists there. She also had a program during COVID, and I'm not sure if it's still in place, where she was providing 5 free therapy sessions, to the Black community, because, we have to break down the mental health stigma in our community. That stigma is still there. While many of us are out there and we're seeking help, the stigma is still in our community. Our emotions are real. They are something that we need to pay attention to. And they do show up in physical illnesses such as cancer, diabetes, high blood pressure. And then when we talk about the physical part, our diet plays a role. Dr. Nia talked about our diet. Spring talked about our exercise, and we all kind of, work out and exercise. All of those things go together. And then if you have, if you don't have health insurance, Okay, the Affordable Care Act that Dr. Todger talked about, Medicaid, Medicare, your local nonprofit organizations may provide services. In Georgia, they're called community service boards. You can go to your county community service board and receive services, even in New Jersey, at some nonprofit organizations on a sliding fee scale. If you have insurance, you can contact your insurance company and you can say to your insurance company, because now that I am a cancer oncology behavioral health specialist, well, one of the boxes that I check off as a specialty is in oncology. You can call your insurance company and say, can you give me a list of therapists in the area that specialize in oncology? Oncology is another word for cancer. And you can maybe find a therapist that way too. But sometimes, a lot of times, like my surgeon said, I can't find anybody like you. I have been partnering with a lot of breast cancer organizations, saying to them, I want to bring mental health to the forefront. How can I partner with you? And the consistent feedback that I'm getting is, we've been waiting for you because we need this. So we do want to partner with you, and we do want to see how we can work together. So it's still a work in progress. Ladies, I'm one part of the equation and hoping to make a difference and hoping that this grows more and that I can inspire other people to specialize in this. But hang in there. Our mental health is important. Don't let anybody tell you that it's not. And self-care is so important, ladies, because listen, healthy boundaries, creating and maintaining healthy boundaries in relationship, stopping the people pleasing. We got to learn how to say no. We have to limit our access to things that create stress, in our lives, because stress plays a huge role in cancer. So I thank everyone so much for hanging in there with us during this panel discussion. I am so grateful for all of the phenomenal panelists that have attended. I see I have 2 family members that attended, my mom and my cousin Angie. Special shout out to all of you guys. Nia's dad attended, Nikita's daughter and some of her friends attended. So we just thank you for all of our family and our friends that have attended. All of you breast cancer survivors, feel free to reach out, guys. Like I said, I have a Thrive Breast Cancer Survivorship course. Please head to your Google Play Store or your Apple Store and download my Dr. Chalice Teach app. I'm going to have more than breast cancer survivorship. I have an upcoming course on breaking free from emotionally abusive relationships. So stay tuned. Again, I thank everybody so much for attending. And please stay tuned every Monday of this month. This is my Pink October series. So next week, we are actually going to be talking about health disparities for all, not just Black women. And we're going to be inviting Unite for Her here. Unite for Her is another organization making a difference in our community. So please register. You can go to my social media websites and all of the links are there. I'm on Facebook and LinkedIn, Dr. Chalice C. Rose, or Instagram at Dr. Chalice. Please visit my website for more information, DrChalice.com. And we love you guys, and everyone have a great night. Bye, guys.